Welcome to the Medical Insider Podcast, where we highlight real-life solutions to your health challenges, incorporate new technology and proven solutions from the past with a healthy dose of common sense, while resisting the pitfalls of idiopathic classifications and economically based medical doctrine. This is your host, Dr. Thomas Santucci. Let's get started. Good morning. Welcome to the Medical Insider Podcast. I'm here with Dr. Sherry McAllister. And Dr. McAllister is an accomplished physician who is the president of the Foundation for Chiropractic Progress and hosts of Adjusted Reality podcast. Adjusted Reality is kind of a cool insider chiropractic joke because chiropractors adjust things. Dr. Sherry started a new position of Chairwoman of iSAW International, and we're going to let her talk about that. In her podcast, you can kind of tell what a person's made of by who they're interviewing. And she's just finished her third season. And her podcast, she characterizes as meaningful and fun conversations centered around health, wellness, and lighthearted, inspiring stories. Lighthearted is something we have never accomplished, so that'll be a good juxtaposition. I just want to recap some of those episodes. So she did a podcast on meals that heal, so like food as drug, and then how to change the world with a former NHL player. And these are accomplished people who have their ideas on really living, and she's going into those kind of details. And then healthcare is in critical care, something that's an ongoing theme. We're kind of thinking we got to do something about the basic structures. Optimizing women's health and hormones, always a great subject. Complex and continually misunderstood. It's amazing how many women there are in healthcare who still haven't figured out basic hormone supplementation, but that's something that she's done. And then muscles for life, get lean, strong, and healthy at any age. I really like that one. You know, the day you die, you're going to have a lot less protein on you than the day before. So muscles are important. And I think we're leaving those out. Overcoming left brain laziness. We'll talk about that a little bit more later. And then healthy habits that create success. This is one of our themes. You create the existence that you want to live in. You're responsible. And then triumph through recovery with retired Staff Sergeant Shiloh Harris. That's amazing because, you know, we kind of look at health either being an optimization thing or a recovery from physical and not so much neuropsychological or chemical dependencies. The people that take that on, they're really artists and, you know, looking at that. So Dr. Sherry is not afraid to take on history, challenges, and lifestyle aspects of health while detailing or dealing with the details of clinical nutrition and neurology to expand the understanding for her patients. So with that, I welcome Dr. Sherry.
Outstanding. Thank you so much, Dr. Santucci, for having me.
Yes. So I was trying to kind of think how to characterize this. And one of the things we had talked a little bit about is it's a difficult age to be any kind of a doctor. There's lots of misunderstanding between groups, and there's lots of protection within more like the conventional practitioners. You're a chiropractor, but you're also kind of an ambassador, and you're also kind of an early adopter, free thinker. What would you say are the best changes you've seen in chiropractic or chiropractic cooperation with conventional medicine and kind of some of the new trends that are hopeful and optimistic?
It is a very extraordinary time to be living in, especially since we've hit some critical, unfortunate events, and one being the opioid epidemic and all that has come with the CDC showcasing 187 deaths a day. When I started with the foundation 6 years ago, I thought 73 was massive. So think about where we are today, from 73 to 187 a day. Then we get hit with an extraordinary time having a pandemic where social isolation and barriers to getting care became the norm. And that also put healthcare providers in this really awkward place where they're trying to do their continued work for those that have chronic conditions, yet they have these very severe acute events that are happening, plus their own health and welfare was at risk. They didn't know at the beginning, as an essential healthcare provider, what they were going to be placed in. So you have to think back to 2019, when the world kind of seemed like a somewhat quote unquote normal place, to 2022, and now seeing the amount of stress that a patient has been put in, and how the medical providers and the healthcare providers that are non-pharmacological, that work has to now be combined into a collaborative effort. And it is absolutely critical now for the healthcare providers to work together. And that's one of the biggest changes I'm starting to see, is that medical burnout is real. Chiropractors are starting to become the essential provider for healthcare, period, because they're having troubles getting into their medical providers because they're either leaving their profession, and they're leaving them in droves, or there is already a gap between how many primary care physicians are necessary and what's happening in urgent care. I just got off the phone with a physician that was talking about being in the ER 15 hours to get care, 15
Right.
hours before he actually saw a
Right.
medical provider. So if I want to talk about the benefits and be positive and constructive, I would say that it is 100% a moment of truth, which is, can you work with a healthcare provider who can take care of the number one disability in the world? And we just break it down to one, that's low back pain. I do
Right.
not want to see a patient in the emergency room with low back pain. They should be in a provider who cares for non-pharmacological approaches to neuromusculoskeletal issues. That's primary. So I think I would say that's one major turning point for us, is being able to educate the medical providers that we are a non-pharm, safe, guidant, concordant choice, so that we don't have them coming into your office for care that could be well dealt with in their office.
Perfect. That's so appropriate. I'm going to transition this, that one of my pet projects is, I think that the scope of practice needs to be rewritten for primary care. The more and more I see any kind of doctor be effective, it's when they've taken an informed generalist kind of viewpoint. And one of the great things about being a chiropractor, and one of the horrible things about being a chiropractor, is that there isn't a delineated scope of practice. I mean, yes, it's musculoskeletal, yes, it's neural, but also it's biochemical, and now we're doing lifestyle. That sounded like a doctor right out of ancient times, not the 50s, but I'm talking about 1,000 years ago, when doctors were the only guy. And so one of the things that I think we really got wrong in the scope of practice is, we made, if you had the title or the letters MD after your name, you could do anything. I had an MD offer to adjust me. And I was like, you're not trained in how to do that. And they're like, oh, well, my license lets me do it. And I thought, that's absurd. That takes like 4 years to learn, and you're willing to do it. It was crazy. So one of the things that I was sort of saying on a detailed level, I kind of was going to throw it together for you, and actually would be interested in your opinions going forward, is that I think orthopedics should go to chiros, who then refer to orthopedic surgeons if necessary. My estimates on that is it'll save about $100 million a year. It's insane what we're doing. When we saw, we're doing physical medicine, but also some of the biochemistry, obviously the neurology, and now regenerative medicine. But when we were doing, knee injections using Wharton's jelly, or even amniotic fluid, or even PRP, we probably stopped 80 knee operations last year, one little clinic. So what's the national implication of that? And then one of the things that I really realize is I have a different kind of education. I was a strategic planner, and I had a finance degree, and I was in that world. The medical education that a chiropractor gets is really pretty substantial, like especially these days when nurse practitioners are running half of medicine. Chiropractors are way better educated than nurse practitioners. I say that with all the love in the world. I mean, it's a great thing. And not that there aren't, variations on each one, but that basic level of knowledge, I think, is wasted right now. And I think that we need it. And I think that there's a time that's coming. The nutrition related illnesses I see as being a split: chiros, naturopaths, maybe nutritionists, clinical nutritionists. And then things like hormones. I happen to be a hormone expert because we're doing bioidentical hormones. But I look at it and I go, who's in that world? And like you look at the acupuncturists who are dealing with chemistry and energy and that kind of stuff. I'm kind of looking for a new world where we actually say, here's all the resources across the board. And now, put everyone on the table and see where they go. We have a history in chiropractic of being unincluded, and then my personal opinion is we kind of, I think chiropractors should own low back pain, headaches, and if you're trained, nutrition, and if you're trained, the neurologic, vestibular rehab kinds of things, like both of those things. And I like the idea of having subspecialties. We're seeing that in individuals, but not as a group. Do you see, like in the beginning of anybody initiating anything that kind of gets a big picture, almost political collaboration with like the AMA or somebody that could actually, do this kind of cooperation?
Let's just be perfectly honest, medicine is a business. Right. And when we want to start talking about collaborative, we need to talk about the return on investment. What does it mean and how does the insurance company maximize their dollars? In fact, if you go to just one system, let's just take the workers' compensation system. Right. And I'm going to take it when times were quote unquote maybe normal in 2019. Sure. Workers' compensation costs for 2019 for employers topped $100 billion. Wow. And that's the highest we've ever seen in history. And remember, this is before things started to go sideways. And meanwhile, there was an estimated 70 million days that were lost due to injury. Mm-hmm. And with that, there was another 35 million days lost due to injuries in previous years. So you can see the uptick, and it is amazing. But let's talk about collaboration. What does it mean and why would we do it? If you just took the workers' compensation and you asked yourself, why are we spending more than any other country in the world to get the care that is really not showing that much more improvement? So you look at the average medical cost per claim, and this is a study that came out through the Workers' Compensation Research Institute. And what they found was, in evaluation and management, the average medical cost per claim was actually 47% lower than that for the comparable non-chiropractic only claim. So if you went to a chiropractor, your claim was 47% lower. The chiropractic only claims also, and this is a big kicker for those that are in self-insured and those are trying to minimize the risk transfer, 35% lower indemnity payments per claim if you went to a chiropractor. And get this, if you want to talk about collaboration, talk about what does it take to get people back to work. Right. If you went to a chiropractor, first doctor, they found that 26% shorter temporary disability duration. Now think of the dollars that are involved in that. Right. If you just take that one study alone, which is fairly epic, and it came out last year, that shows you that you have to look at the cost of benefit. Other areas where chiropractors have been seen to do astronomically better, patient satisfaction rates. Several studies will show us in the high 90s, where a lot of our medical practitioners, and I want to show absolute respect for them because it is imperative that we work together. But unfortunately, they have very stressful moments where they're in, the patient has 7 complaints and they're trying to figure out who, what, where, when, how, and they're not touching their patient. And that's a big part of what chiropractic is. So we have that satisfaction rate. Also, a big part of care is fragmentation. If you start with a medical provider, for example, for a low back episode, do you stay with that medical provider? Because fragmentation of care, meaning that you go off, you see an acupuncturist, then you see the medical doctor, then you see the orthopedic surgeon, then you go back to the primary medical care. That's extremely expensive, and
Right.
it increases our cost tenfold. It is looked at as the lowest provider for fragmentation of care is chiropractic.
Nice.
So that means the patients start there, they end there, and that is in fact why 47% of the cost is lower with that. And then we look at one more piece, is we look at concordant care. Now, here's the unfortunate part. We've seen studies that have come out that actually showcase if a medical provider does not follow the guidelines that are set forth in treating, an example, low back pain, and they give them an opiate, that's called non-concordant care because it doesn't follow the right current best practices.
Right.
What happens when they do that is they set that patient up to go from acute episode of low back pain to a 30% chance. That's a big deal. A 30% chance of becoming a chronic low back pain patient for life. Imagine an insurance company wanting to pay for life for chronic low back pain. So that concordancy to care, when you start with the right non-pharmacological option first, saves the insurance company, saves the patient's quality of life, and in fact, helps the entire industry move forward in a way that showcases best practices.
Right. We got the same conclusion when we looked at even low back pain, cervical pain, and headaches. There's like almost $500 billion over 10 years that could be saving. So when we're talking about healthcare being a cost that's spinning out, traditionally, I can really relate to the statement of being the last doctor. I mean, our statement used to be that you had to be kind of a genius to find us. And if you did, we understood that we were your 10th doctor and you had no money. At the same time, we only took on workers' comp claim as a huge favor because the system was so unwieldy. And what they thought was normal, we were throwing the book at it. We were doing the advanced neurology, the vestibular rehab. I had a $500,000 worth of rehab equipment. We had people that really cared and knew what they were doing. We were doing it all. And they would walk in and say, how come you didn't fix the person in 4 visits? And I was kind of like, I will sit at the feet of the person that can fix someone like this messed up in 4 visits. And then the other thing that I just think really needs to change is the whole business of employers really having insight into what's going on. We sent them to the orthopedic surgeon, and my little brother's a surgeon. He's a fabulous doctor. He's really a clever human being. He's smart as hell. He's well-meaning. I wouldn't let him design an exercise program if my life depended on it, and he wouldn't know what to do with a bulging disc or, an inflammatory cascade or, all the things that we kind of view as normal in a rehab world. But he thinks he can, and so I was like, okay, the minute you put down that scalpel, that patient's mine. And that's what we did. And so it was fairly aggressive. We got some pushback, especially in the neuro side. And, we're like, the Carrick neurology is better than your neurology. So I'm not as collaborative as you are. You're much nicer than me. But, I was like, no, you don't know how to do this. And I do. But even in those systems, we would elect sometimes just not to be paid rather than to deal with kind of being judged by people who didn't have the details on how to do it. One of the things that I'm looking at is in 2 different situations of setting up a medical system in another country, and where you just take a blank sheet of paper and you go to St. Thomas and you basically say, I'm taking over the medical healthcare system. And without the politics, it isn't that hard. And then you don't leave any resources on the table. So I still I'm kind of a cautious optimist when this is coming down to it. I see a lot of very good doctors and I see a lot of people frustrated on all sides. And then once again, I kind of don't see, just from, my little world practicing, I don't see the institutions really catching up with what people want. And I remember being in the California Chiropractic Association for a while there after I'd practiced like 10 years. I was like, I'm going to give back and do this thing. And we were going to write the strategic plan. So I was a strategic planner before I was a doctor. So I was like, I'll donate that. And I had this tagline that said, my chiropractor is my primary care physician. And we were going to do like billboards on a bus. I turned so many people to a lighter shade of white than they already were that you couldn't possibly believe. It was like, are you kidding me? And I was going, what are you talking about? It's our license. We're allowed to say that. And they're like, yeah, but that'll like raise eyebrows and cause problems and do all this stuff. And I said, then let it do that. But that's what California has done. Even now, it's kind of bimodal in terms of like acceptance in society. So we spend a lot of time going, I'm a certified nutritional specialist. I've got, 1,000 hours of advanced neurology, that it's almost like we need to change the word or something. It has to be these, physical medicine, first alert doctors or something. Because right now, if it's MD and it's chiropractor, I've emptied MD cocktail parties by saying everybody deserves individual care. I don't see it at my level, but hopefully your generation is going to do a better job than we did at collaborating, because we just sort of thought, hopefully there's a opening there. It's almost like I'm beginning to see in this late stage of life, like I'm almost 70, that politics is the answer, that getting into something that is got some political teeth makes a difference. So tell me a little bit about the work that you're doing. You're a chairwoman of one organization and a president of another organization. What's going on in politics?
Well, you had a lot that I want to unravel there, and I want to thank your brother for being an orthopedic surgeon. And I think it's relative to go back to the costs, because it's what functionally, even with politics, is we try to get the best outcome with the least cost. That's why we end up going to Target and Walmart, right? We have something, we don't want to spend an exorbitant amount, but we want to get a value for our dollar. And having you note that your brother was an orthopedic surgeon, it comes back to let's think about.
He's a urologist.
You're right. Then I wouldn't definitely want him doing an exercise program. But if you look at, and we stay true to form and just, apples to apples, and going back to low back pain, there was a study out of the Journal of Neurological Sciences in 2021, and the author is Dang. And what he noted was that 1.2% of patients with low back pain actually receive surgery, which is a good number for their problem. But here's the thing that should get people, and this is where you have to stop and think, what? 30% of costs were attributed to those 1.2% in the big picture. And this finding is especially concerning given that laser spine surgeries grew in this one study by 276% between 2002 and 2014. So a massive growth, even though it's minimally invasive. It costs 30% of the expenditures for workers' compensation. So that 1.2% of people are spending 30% of the dollars. And that's where I start to contemplate something's not right. When you start talking about collaboration, that's the time where we have to start looking at who's providing the best quality care at the lowest price, putting the patient at the lowest risk. As we move forward, and I start thinking about being the president of the foundation, is trying to get the knowledge and the wisdom out without creating an abrasive outcome. So one of our podcasts is The Truth. It is absolutely, it's by a legendary doctor, Dr. Lou Sportelli. It just came out on September 15th, which was the Founders Day week of chiropractic. And it really talked about the assassination of the chiropractic profession in logistics, like true to form, like no one else could do. Dr. Lou Sportelli put it down because he is in that age range where he was there, he heard it, he saw it, he felt it, and he knew that something had to change because a healthcare patient looking for health care can only find it if it's an option. And what happened with the AMA trying to take out the chiropractic profession was that their options were going to be depleted, and that the power, the political power, remember, people will do for power what they won't do for money. The politics are real. we are looking now at the intentions of power in politics that leads into medicine and healthcare. And sick care is one piece of it. And that's where the medical providers do a fabulous job. When you're sick, that's where you need to be if it's neuromusculoskeletal. You want to stay well, healthy, strong, resilient, have that zest for life. Then you start with what makes sense, which is a non-pharmacological approach. So organization that I work for is called the International Strategic Accelerator for Women. And it provides women with a opportunity to maximize their growth. And what we've seen over COVID, which is extraordinarily unfortunate, is that women took a bigger hit in COVID than men did. And it's primarily because of their care provider relationship. So if the children were out of school, the women scaled back. And so there's a now very unfortunate equity of pay that is happening for women right now because they did step away to deal with the unfortunate healthcare issues that many had to face with it. And maybe it's elder care. Our elders were at severe risk. Many people don't know this, but if an elder was taking an opiate during COVID, they're at greater risk of adverse events with COVID-19. And that information doesn't get out very often. And it provides an opportunity for us to really look at when you're taking medications, does it put us at risk? I like to think that people need to understand if you're taking a nonsteroidal anti-inflammatory, your risk of bruising and bleeding and stomach upset and skin reactions and blisters and increased risk of heart attacks and strokes, they're all real. I mean, that's a real unfortunate outcome. And for a lot of medical providers, they don't think of adverse events when they write the prescription. And I do want to stress that as much as the past has played a role present, we have to go back and start thinking about these moments where we start to bond together for the best patient-centric care. And that means that the doctor who writes a prescription needs to consider non-pharm first. And that's by the American College of Physicians guidelines. And so the jobs that I do fundamentally work really well together, which is, in chiropractic, we're very blessed because the balance between female and male ratio is starting to come to a beautiful balance. But in many countries, that's not the case. And the equity of care for patients across the world is very different as well. So working to build strength in both healthcare as well as women being able to network and provide greater benefits across the world is kind of where my personal niche has been. And I love both jobs. Chairman of iSAW is a voluntary position, and it is to non-disclosure payment for the Foundation for Chiropractic Progress. As the president, really, they have immense benefits because I see the world in a different place. And I really, truly believe we're heading to a much better healthcare system if we put in place what we learn from the past and we develop these core relationships. Because the one fellow that I talked to who was very high up in the leadership chain at the Family Physicians Association, he mentioned to me that I love utilizing chiropractors. He said, leadership above me has some issues. They're older. And he said, sometimes it takes a fundamental change of rank in leadership to have these collaborative moments happen because, some MDs have no idea why they don't like chiropractors. And I can tell you, if you listen to the Adjusted Reality podcast, Contain and Eliminate with Dr. Lou Sportelli, I think their eyes would be open because it was a slanderous position that we were put in. And they used celebrities like, Ann Landers and Elizabeth Taylor to really get out a negative message about chiropractic that was unethical, dishonest, and was trying to literally eliminate the chiropractic profession. And now we can have these open conversations where medical providers now know, oh, that's how this happened. It was a political thing. And you asked, how does politics play in? That's one way. Understand the past so we can move into a beautiful, brighter future.
I really like the way you're framing that. I remember growing up in a medical household, if somebody needed an operation or a thing, we talked about, is Bierbauer the better guy? Or we're in Washington, D.C., so my dad went to Georgetown too, and Johns Hopkins would be a good thing. I don't think we'd ever heard of Stanford, so, it wasn't this world. And mentioning that somebody had gone to a chiropractor, and my father putting this distasteful look on his face and saying, they're not scientific. And I didn't even know what it was. And then in my own sad story, I broke my neck, I broke my back, I couldn't walk. They're like, you'll never walk again. We're going to cut one of your legs off. And a chiropractor fixed me in 3 months. And then I was like, I don't know who these people are, but I think I'm going to become one of them. I was going to be an orthopedic surgeon because I was like, I have to become some kind of doctor. I got too much wrong with me and no one's going to fix me. So that was my whole motivation. So I had this amazing female, applied kinesiology, meaning heavy biochemistry and touch, chiropractor. And she just went in system by system and started turning things back on. And she was the one that really first said, this is a self-healing mechanism, which was what I had always believed. I was like, no, you don't have to do extraordinary things. You do have to, keep your cellular reserves right. And you do have to be a certain kind of person, but then your body will heal itself. And that's what they believed. And I still think that that's like an essence. It's a core thing that it's kind of a freebie, like God gave it to us. So we should start there, see what we can do to bring a person up to their potential with that stuff. And there's a great chiropractic analogy that I use a lot these days. And I was like, because we do chronic acute cases. We do the cases when the thing's really going to hell in a handbasket. That person potentially is going to die. The body's self-healing to about 30 degrees, either way. When it's here, you need some kind of interventional help. And that is where most of us are spending most of our time. In the lifestyle thing, I think that, we kind of poo-poo it. The activities of daily living, it's like an add-on thing that you write at the bottom of a report that nobody really does anything about. But when you're dealing with the long term, those healthy habits turning into longevity is a thing. Before COVID, I could say of all the people we had treated for 25 years, we had only had 5 deaths, including old age. The number of zeros in front of that as a random probability is like 5. It's impossible. And yet that's our numbers. And then when we look at acute interventions, when we're doing, physical, biochemical, neuro, and now regenerative medicine, our numbers are at least as good as the best people in conventional medicine and probably much better. And yet, if you go to say any of those things, and I'm doing a lot of medical education these days, where I'm in big rooms with MDs, they're so cautious. I mean, we're not allowed to make medical claims. We're not even allowed to officially diagnose. So we have all these clinical impressions that just turn out to be what the person has. But, officially, we're not allowed to diagnose, which is very rich. Anyway, so they're so good at saying, yeah, we strongly suspect that that's what's going on here. And I go, everyone's known this for 10 years. What do you mean you strongly suspect? And they go, the research isn't in. So I think physicians in general, and I mean both sides of the line and every single complementary and alternative group also, are being stifled. You're not allowed to say you can cure cancer. You're not allowed to say you can change heart disease outcomes. You're not allowed to say you can do anything with stem cells. So all the things that I think common sense, nobody's allowed to say. And maybe especially in this post-COVID world. And I personally think understanding, immunizations and that whole immunology world I'm very glad I don't have that job. I'm not crazy about how it's being done, but I'm not sure I could have done a better job. And so I don't have an official opinion there. There's certainly not one I'm going to say in the air. But at the same time, we're all being kind of suppressed in terms of like, where's the common sense of this? And one of the things I'm really looking forward to is doing like pure research, because then you just say, I'm just researching the outcomes for Alzheimer's. And I think stopping brain inflammation, maybe doing some autoimmune work, maybe doing intranasal stem cells, and then doing a brain scan and neurofeedback might be an approach. Those words roll off my tongue really easily. At the same time, I've never seen a headache that didn't go away with a chiropractic adjustment in my life. Never. And I'm like, why do chiropractors not own headaches? And then low back pain, come on. Like chiropractors are absolutely the best at that. And yet if you say that, that's what I would do. I would own headaches and I would own low back pain inextricably. And not that there isn't variance within the thing, but I'm still getting that, does this cause strokes? And I was like, wow, did they dig you up out of a 100-year-old hole in the ground? Like it never did, like where'd that come? And we know where it came from. But I just, sort of tying that thought back that we always compared outcomes and strategies to Western Europe. So I always looked at Germany. They got doctors. They're smart. I looked at Japanese people. They have a little different, longer term attitude maybe than we have. And they do, well, in the day, it was like 1/8 the number of surgeries that we do and have the same outcomes. So they obviously spend way less money, but also they don't put people through needless surgeries. And it's a hard thing when you're coming up. I'm probably way more oppositional than you are. Our strategy is to be a gladiator and just do it better than everybody else and not be very sympathetic when people are not doing it what we think is the right way. So hopefully people are as diplomatic as you take over and people like me don't, but I'll just run my little hospital. But anyway, but I think going forward, it's going to be really hard with those people in place to say, oh, by the way, we're doing 80% needless surgeries in this country.
Here's a couple of things that do get awareness is number one, ease of care. And it's easy to give an $8 bottle of Vicodin. Right. It's easy to take that $8 bottle of Vicodin because you're not missing work. And it doesn't cost you anything because the insurance company has elected to cover all of it. And there's the ability to mask the pain because a lot of patients are unaware that you may not be actually well just because you're not feeling the symptoms. And so we have an incredible amount of reality to face that education is key, and where they're getting that education from is absolutely incredible. Right. And one of the things that is very important for the person out there that's looking for true wellness care is look who's actually getting the outcomes that you want. And one of them comes to mind is a Dr. Susan Welsh, who works out of the hospital in Florida State University, I believe it is. And she's there with 13 or 1,500 employees. She works as a chiropractor in the traumatic brain injury unit. Now, first, the days of, like you said, chiropractors do X, Y, and Z, and it's all negative. One happens to be stroke, and that is a very unfortunate because you're right. When they don't keep up with the research, it's painful. But she was one of the first staff members to ever get a Press Ganey Award. And one would ask, what is a Press Ganey Award? And not only now has she won, she has 5 of them. A Press Ganey Award is, Press Ganey sends out a survey and it comes back on the quarterly, and hospitals use it to see where their quality of care indices are. And I'm sure that bonuses get wrapped around it. But this one individual, this one chiropractor in the traumatic brain injury, and you have to know, for those of you listening, when you're dealing with traumatic brain injury patients, those are the toughest patients to deal with on multiple levels. Number one, there's a severe emotional component to having traumatic brain injury. Sure. Number two, quality of index of life is impacted. And number three, they may or may not be cognizant enough to even have the ability to adhere to treatment programs. So you always have an advocate with them. And she actually had 100% patient satisfaction rate. Wow. 5 times. So wow. I want to go to the provider who is in these very difficult positions and get the care that is necessary for me to live a well-balanced and highly active lifestyle. And that's where I want to between the sick care and the well care. And, it's one thing, like you said, you became a physician because you had issues that you wanted yourself. That mean without your chiropractor, where would you be right now? You may not even be on this podcast, but
Right.
we look at some of the things that you talk about, back pain, neck pain. Well, where do you start with those? The pain is a red flag. It tells you that something's not right. And if you start with a chiropractic adjustment, that starts the whole beginnings. Now, what's best about chiropractic is we're not just a modality. We're not just an adjustment. We are a lifestyle. So we look at addressing the muscles, the exercise, the home care, the nutrition, the hydration, the anti-inflammatory diet, the supplements may be needed. And then ensuring that your ergonomics of life and sleep. Like I know we had a conversation with an ultra marathoner on my Adjusted Reality podcast. He was not aware that there was such thing as sleep ergonomics. And yes, there is,
Nice.
Being able to have your activities of daily living increase. And there is a study through Adams, through Spine Journal, and it was in 2017. It's a 12-year longitudinal study. It's a massive study, and yet no one really took that much time to really showcase. But what it shared in this 12-year longitudinal study was why people were going to chiropractors. And the study was really impressive. People were going to chiropractors not because they were in pain. They were showcasing that their quality of life was improving, their sleep was improving, fitness levels were improving, how they felt generally was improving. And that tells you that we need to look at more research. There was a study done, it's called The Verdict, as well as the Act One that was done in the military that was talking about military. If you talk about pain, in this one study that was $7 million that was done by the government, Act One, it showcased that those that were seen by a chiropractor for low back pain, they increased their activities of daily living. They had greater mobility in what they were doing. They had greater stability in what they were doing and greater flexibility. And isn't that what everybody wants in life? When you get up from a chair, you want to be able to get up and feel strong, that your hamstrings and your quads participated. Being able to lift up your grandchild or, walk your dog, that doesn't come from a pill. And one of my favorite Yogi Sherry quotes is, the past was a pill for every ill. The future is a DC to nurture. You need to be nurtured. And that's what I believe the future really depends on. An MD does not have the time or the specialty to have the nurturing that a chiropractor will bring to that patient, because we're not talking about the illness, we're talking about the wellness.
Yeah, clearly it's solving a different problem. And so in foreign service, there's something called long-term enlightened self-interest, where you do many things that aren't immediate paybacks because next year or next decade or 100 years from now. And we're part of the Japanese design of the 100-year health plan. Then they actually have a 200-year health plan. And you're sitting there going, wow, like we're having trouble thinking about next month. And it's just a different attitude. And one of the take-home messages that I think is really true is that it is more efficient to certainly do the acute care before the illness. Like if you do your rehab for cardiac before you get the heart attack, that's a much better story than if you wait till after a heart attack or stroke. And then it's better just not to get cancer. And both of those things are avoidable conditions. All of them have, a pretty steady state that shows you're going to get to this point. And in my opinion, diagnosable, predictable, all that kind of stuff. And then when we're looking, especially at this stage, I have a lot of patients my age, and we're talking about strength, vitality, and let's face it, longevity. And I don't know how many times I've heard, oh, I don't really want to be alive if I'm not in good shape. The supposition that you wouldn't be in good shape. And there's an amazing sort of like health metaphor is that your life is like a candle and it burns down an even light and then one day it just goes out. Hopefully you made love to your spouse that day and had a good breakfast. Then you just die, and as opposed to you spend, if the average death age is like 77, 76, depending on which study you like, those people are busy dying for 10 years before that. They're my age and they're dying. And we see those people. And, you look at Russia, with what's going on, the average death age for males in Russia it decreased. That's bad. By 4 years in the last 20 years. Definitely an alcoholism problem, definitely a meaning of life problem, definitely a roles in society problem, lots of infrastructure-y kinds of reasons for it, but it impacts whole countries in the way they are. And one of the things that I think that we can do is we can put out a picture of a different model. So I think living to 95, it's actually statistically almost impossible to live past 93. Everybody has everyone knows somebody that's 100 years old, but you don't know 5. So it's almost impossible. So people die at like 77, 85, and 93. So what are the people that aren't even close to dying doing? And almost all of them have some kind of a physical regime. Half of them are probably chiropractic patients. Like all of my patients that are super, super healthy still want me to adjust them, even though I don't really do that on a daily basis. But if I get a really serious patient, I'm going to adjust them. If I get a person who just won't leave me alone, then I'll adjust them. Now, we're also doing a lot of other things, and we have programs that kind of measure biochemistry and neurology and intervene almost in a sickness way, but in a longevity way. Like, I think that's sellable. I think it's let's change your death date. Let's change your expectation of how vital you are in this existence. And I think, especially in the Silicon Valley, I mean, you're in my same town. Everybody here is so on the treadmill and so obsessed with progress because there's so much pressure here. And we've had people move back to New York City to have a nicer life. We're in a pressure cooker.
Yes, we are.
Yeah. So it's hard to say, I want to get you to live to be 93 or 95. But I notice when I say it, the next time I say it, person wants to understand what that looks like. So we're looking at kind of putting together what does that model look like? And again, physical, biochemical, neuroenergetic is kind of the way we view the piece parts. Again, when we're looking at the physical side, half the time people are going to 3 doctors to do what a chiropractor could do, especially a good one. We're not the 11th doctor anymore. We're like the 4th. So it's not so bad, but we're not the first. And I just look at it and I just go, wow, because, I have 20 years doing that or 30, you've got a bunch of experience and capability. Why weren't we the first one? And the answer is we're probably not on their insurance and we're not being referred by their PCP. And yet their PCP doesn't want to do the work that we can do. We get PCP referrals because we usually fix their parents. I fix the guy's mom. So now he'll refer people to me, but it's not like his friend said, oh yeah, these people can handle a part of this thing. The one you don't want to handle and the 2 you're not set up to handle. I think that there's an opportunity there. And I'm sort of hoping that there's financial pressure because I don't see the politics of it changing that quickly, at least in my lifetime. Hopefully you'll have the presence of mind to stay as positive as you are and keep pushing on that rock. From my point of view, I have like 5 more years of pushing on the rock by changing individual outcomes. We are very successful at getting people well. And I think that if a whole bunch of people do that, eventually it gets out. Political point of view, I almost hope that the recessionary, inflationary, and long-term debt pressure comes in and says, we have to stop spending, $500 billion a year on healthcare. Because again, all these other countries that are doing it better, and everyone knows these statistics, our statistics are, we spend the most or, in the top 2. And our outcome is like 63rd or something. No, it's not even close what it could be. And, especially when all you have to do is copy another group, The Italians are using chiropractors as primary screeners for a whole bunch of things. And I'm Italian. I love Italians. But when the Italians are out producing you, you're doing something wrong. It's like, come on, all you have to do is copy. So I'm encouraged that, we're kind of moving toward it. I'm encouraged that it's becoming more inclusive. In my practice, the very best followers of complex acute situations, which is really functional medicine, physical medicine management, are females. That from a neuro point of view, we know that, the female brain has a bigger corpus callosum. It can multitask, even though that's a false word, but they can handle more of those details and is a little bit better at situational diagnosis, reading the room. And so I do think that females are key in this. Being a male, traditional old white guy, I actually think everybody is important in this, but I think the people that are going to drive it are going to be female. And I think that they're going to be younger, which is weird coming from being me, because I think I'm one of the people that's going to drive this. But I never really thought of myself as being male or female when I was a doctor. So I never really had any of those kind of issues. I just sort of saw it as, I'm the person here to solve your problem, and it's like, and I'm completely busy doing that. I don't have any extra to like emote sexuality. And so I get that it's a big subject these days. I'm kind of like, whatever it takes for anyone to step up, I'm for. And then ultimately, I don't want to leave half the population out of anything, whether it's rich or poor or male or female or, any kind of preference. I don't really care about any of those things because it has to be that it works for everybody. And then men, and I make fun of men, and I'm allowed to because I am one. And men we have neglect as it's like almost like a standard diagnosis. We can be bleeding from an artery. If you ask us how we're doing, we're going to say fine. We are programmed that way. It's not a good or a bad thing. It's just a true thing. And the women are the only ones that really see it. So like with my wife, every once in a while I go, is there a 2-ton rhinoceros running at the side of me? Because I might not see it. Whereas I can diagnose you from across a parking lot. It's like, it's what we can all see. So I'm really kind of big on, it sounds a little bit of like kumbaya-ish that, like we all got to work together. But I think there's individual skills and talents. And I think the people that are going to make the changes are going to be female. And I think that they're going to be your age. That's why you're on this podcast.
It's insightful. And I will tell you that from experience of where I see the impact of how women and men come together, most of the highly successful corporate 50 companies have a balance of gender equity. And it's because it's what you see, and women will see things differently and men will see things differently. And it's incorporating those value statements and bringing in the important visibility that comes from women coming into the workplace and also into the medical practices that will help balance it. And sometimes it's just as frank as men may want to talk about their prostate with a man, as women may want to talk about their menstrual cycle or their menopause with a woman, only because there's certain times where comfort of being able to say, can you reflect on this with me, and not having to worry about how it was worded or what they may think. And that comfort zone is there. And it's an important piece to the patient to feel that comfort level. And it also goes with diversity, in that if your first language is not English, then it does make a difference. And there's a barrier to understanding the physician or understanding the patient.
Sure.
So I am a very, very strong advocate for being able to have a comfortable situation for a patient. It's not about the doctor, it's about the patient. If the patient has had a very unfortunate sexual experience, violent, for example, and it happens to be the opposite sex, they may never feel comfortable with that provider because there's always going to be a trust issue. We couple that with, sex trafficking that comes in, and women more trafficked than men, but don't ever underestimate the power of where men are sitting too, and that they need to have an ability to have an outreach and a comfort level with that provider as well. So the diversity, the equity, and the inclusivity are pieces that we do need to bring forth and have our mirror up to say, am I opening this office or this visit with the best I can do for the patient, and in hearing them and providing them? Because if English is not their second language, it might be the best to have a companion in the room that speaks the language, so that there's always a translation. They can feel comfortable. The doctor actually hears that, I'm not sleeping. I'm sweating during the night. My throat has been sore for months. All these things come into play, and you need to have the right questions, and the patient needs to be able to execute their communication pattern as freely and as comfortable as possible.
Nice. Well articulated. So I think we're going to hold it here. We're probably going to chop this up into 2 different podcasts and do it that way. I think you and I could talk for days on a lot of these subjects. So it's been enlightening, and I really appreciate your insights. And I'm more optimistic than I was an hour ago. So that's a positive thing. I am working on this project of redoing the scope of practice, and I think I'll tap on you to get your insights on that. I do think that there needs to be some primary work on actually saying how medicine should be run. And I think it's got to be the people in the middle of it that are kind of looking at it. So once again, thank you so much. And I'll get you a copy of all this.
Outstanding. My pleasure. And I'm very proud that you took this and you're now taking it to the next level. So congratulations. I wish you the very best in how this rolls out. And I'm always here to support you.
Great. Thanks again. Bye-bye.
Take care.
Thanks for listening to the Medical Insider podcast. If you enjoyed today's episode, make sure you visit medicalinsider.com. Go ahead and sign up for these episodes. Get them sent directly to your inbox. Do us a favor and give us a like.